Coccydynia is a condition which affects the coccyx, which is the four vertebrae, which typically have four residual vertebrae, the tailbone as it were, which are at the very base of the sacrum. Now the sacrum is made up of 5 fused vertebrae that makes the sacrum, which then becomes part of the pelvis. The coccyx at the bottom here, in most cases is no problem at all. If you fall on your bum and you can get exquisite pain because the tailbone can get pushed and irritated, bruised as any other area of the body could. The problem with the coccyx is that it is a swine to settle down and it can remain uncomfortable for a long period of time. If you do fall, you do injure, you do damage the coccyx, trying to offload it is a very good idea. So sitting on a cushion, making a towel that allows some offloading of this area here, so making a towel into like a donut shape, these sort of things can help. If you can manage it well and try and calm it down as quick as possible from the initial stages, hopefully it won't then become chronic. When coccyx issues become chronic, they're quite tricky to manage in many cases. We've had good success over the years with doing manual work to mobilise and stretch things out. These are in cases that have been there for many weeks, if not months. That can help well. It can help to calm down things like the pudendal nerve and actually reduce pain generally. Sometimes acupuncture can be of some use, although in my 20 years of experience, it's probably not my first, by no means my first port of call. Maybe try it if other things haven't worked so well. Manual work would be one. Improving the general strength and mobility around the lower back and pelvis is definitely worth doing as a general thing, which helps. In some situations, a steroid injection can be considered if conservative management's not helped, and there are other measures that can be looked at which are more invasive. But in the vast majority of cases, things do settle down spontaneously without any help at all. In some cases, physiotherapy can be helpful, and in a very minority of cases, more intervention needs to be considered. But it is a very painful condition, usually self-limiting. When it becomes chronic, it can be tricky to manage, and certainly getting assessed if it's chronic and treated, starting with conservative management before you consider anything more drastic, will be sensible. It's a tricky one, and hopefully you don't get it.